I think you got muted with the rest of us, Rebecca.
Can you hear me now? You can hear me?
Yeah, we can
Yep.
hear you now. Thank you.
Okay, perfect. Thank you. So let's back up. I was just saying, welcome to open enrollment. We have a lot of changes happening with the benefits. We are moving all benefits over to United Healthcare. That would be the medical, dental, vision, voluntary life, disability benefits, critical illness, accident, the employee assistance program. The health savings account, as well as the flexible spending account, will be staying with WEX. Open enrollment starts October 23rd and will go through November 2nd. All elections that you elect during open enrollment will be effective December 1st, 2023. These elections will remain in effect for 12 months, so through November 30th of 2024, unless you experience what we classify as a qualifying life event. So as a reminder, open enrollment is that one time of year that you can make a change to your benefits. Maybe last year you had dental coverage for yourself, but this year you want to add your kids, or vice versa. This is the opportunity for you to make those types of changes. What happens if I have one of those qualifying life events throughout the year? We've listed on the screen examples of those: marriage, birth or adoption of a child, if you or your spouse lose other coverage. These are all examples of what we call qualifying life events that would allow you to make a change to your benefits. If you have one of these changes or one of these events, please let your HR team know within 31 days of that event date. If that 31-day window expires, unfortunately, you will have to wait until the next open enrollment before you can make a change to your benefits. Who's eligible to be on the plan? Your legally married spouse, your domestic partner, your children under the age of 26, disabled dependents, and any grandchildren whom you claim as a dependent for federal income tax purposes. Let's talk about the medical. Again, we're moving from Blue Cross and Blue Shield over to United Healthcare effective December 1st, 2023. We still have 3 plans available to us. With those 3 plans, we have that high deductible health plan, we have the base and the buy-up PPO. All 3 of these 3 plans have things in common, and we've listed that there at the top of this chart. They all have in and out of network benefits. They all utilize the exact same Choice Plus network. All plans are going to cover preventative care at 100%. And all 3 of these plans, including the high deductible health plan, are going to cover virtual visits at $0 cost to you. Specifically on the PPO plan, and that's going to be the base and the buy-up plan, you're going to have co-pays for office visit co-pays and prescription drugs. The PPO plans are going to have a lower deductible. The high deductible health plan is going to have all services go towards that deductible first. With that high deductible health plan, it allows you to put tax-free or pre-tax dollars into your HSA. And the high deductible health plan will have the lowest premium deduction from your paycheck. So here are the 3 plans available to you through United Healthcare. These plans look very similar to what we have today with Blue Cross and Blue Shield. We try to match your current benefits as closely as possible, but there are going to be differences, so I don't want to lead anybody down the path that these are exactly the same. We're going to go through some of these differences on the next couple of slides. The first plan I'm going to focus on, again, is that high deductible health plan. With this plan, it's a $3,000 individual deductible, $6,000 per family. That calendar year out-of-pocket maximum is also $3,000 per individual, $6,000 per family. This means that once I reach my deductible in network for covered services, I'm picked up at 100% for the remainder of the calendar year. So let's back up a little bit and talk about calendar year. We are all insured today with Blue Cross and Blue Shield up until November 30th. Our deductible that we've met with Blue Cross and Blue Shield from January 1st to November 30th, 2023 will be applied to our December United Healthcare deductible. So you're going to receive credit for it. Unfortunately, it's not something that happens instantly. There is a process that happens. We have to make sure that all those claims are processed and paid through the end of November, and typically that happens around between December 10th and 15th. At that time is when they will provide us a report that we're able to give to United Healthcare to update our accounts. So it's not, I just don't want everyone to think, oh, on December 1st, my deductible from Blue Cross is magically going to appear over to United Healthcare. It is going to take some time. If you have a situation where you know you've met your deductible and you have services to in December, let us know. We can give you our contact information after the meeting and we can work with you on a one-on-one basis. The other thing I want to note is that everything we talk about today is going to be in-network benefits. You do have out-of-network benefits with United Healthcare, but we really focus on in-network because they have one of the largest networks, not only here in Central Texas, but across the United States. So back to that high deductible health plan. Once I've reached my individual calendar year deductible, United picks up at 100% for the remainder of the calendar year. That means prescription drugs, office visits, hospitalization, whatever it might be, as long as it's in network, I'm covered at 100% for the remainder of the calendar year. Next, we're going to focus on this base PPO and buy-up PPO. Under the base PPO, it is a $1,500 individual deductible, $3,000 family deductible. Once I reach my deductible, UHC picks up at 80%. That's where that coinsurance is listed. I'm responsible for 20% until I reach my out-of-pocket maximum of $5,000 per individual or $10,000 per family. Under the base PPO plan, my copays and deductibles and coinsurance are all applied towards my out-of-pocket maximum. The base and the buy-up plans work exactly the same except for my deductible and my out-of-pocket max. Under the buy-up plan, my deductible is only $500 per individual, $1,000 per family. My out-of-pocket maximum is $3,500 per individual, $7,000 per family. Again, it's an 80% coinsurance. There are some differences here that I want to point out under the base and the buy-up. For primary care office visit, if you have a dependent that is covered under your plan that is under the age of 19, as long as they are going to a primary care physician, that includes family practice, general medicine, internal medicine, pediatrician, all of the primary care physician office visits for under age 19 are picked up at 100%. There's no cost to you on that base and the buy-up. It doesn't have to be just for preventative. Maybe you have a teenager that has a sinus infection. Maybe you have a smaller child that has an earache. Whatever the case is, as long as I'm using a United Healthcare primary care physician, there's no copay responsibility. All others is a $25 copay for primary care physician. Next, we get to the specialist office visit. Again, we're talking the base and the buy-up PPO plans. You'll notice the one footnoted there about a UHC designated network provider. If I go online to myuhc.com, you'll see they have what we call UHC designated providers. These are done by quality and cost. If they are noted as a UHC designated provider as a specialist, I only pay $25. All other UHC in-network providers for specialists are going to be a $50 copay. Telehealth, we call that telehealth, we call it telemedicine, we call it virtual visits. Those are covered at 100% regardless of which plan I'm on, as well as wellness care. Wellness care includes those annual adult physicals, well baby child checkups, mammograms, colonoscopies, flu shots. These are all examples of wellness care picked up at 100%, and this is included on that high deductible health plan. Under Blue Cross and Blue Shield, if you recall, and you've been on the plan for a while, we had a separate out-of-pocket maximum for the prescription drugs. That's no longer the case. It's bundled into our medical out-of-pocket maximum for the base and the buy-up. United Healthcare lists their prescription medication a little differently. They don't go by generic formulary or non-formulary. They say tier 1, tier 2, tier 3, and tier 4. Under tier 1, it's going to be mainly your generic medications. Tier 2 is going to be mainly your brand name medications with a few of those higher dollar generics included. Tier 3 is going to be those more expensive medications that we're seeing at night on commercials. It's going to be what we would consider non-formulary medications. We've listed the appropriate copay. I know we've had communications sent out to employees as well. Really encourage you to go and use the tools we've provided to make sure that your medication's covered. That's really the biggest complaint that we ever get when changing medical providers. Each carrier has a different preferred list, so we encourage you to talk to your doctor if your medication is not included in the United Healthcare preferred list, so he or she can help you find the best medication that's covered under your plan. These are some of the other services that are covered. Just a couple of notes here. If we're talking about inpatient hospitalization or outpatient surgery, it doesn't matter which plan you're on, your deductible is going to apply. Same with maternity services. We always encourage urgent care over emergency room. You'll see that you have that $75 copay on the base and the buy-up plans. Just some tips and tricks. Again, once we're all on the system, you'll have an actual login like you do under your current carrier that you can go out to myuhc.com and register yourself and log into the system. Right now, you can still go out to myuhc.com and register as a guest. We use that whenever we're doing presentations like this, so I encourage you to do so. You can look for medications. You can do the pricing on the different medications. Encourage you to check your explanation of benefits, your EOBs. Doctor offices are human. They make mistakes. But what really typically happens is that they're sending you a bill for services before United Healthcare or Blue Cross and Blue Shield has had an opportunity to process that claim. So I encourage you to look at your EOB. We never want to pay more than what our EOB states is our responsibility. Number 3, ask your physician for samples. If he's prescribing a new medication, ask him or her if they have a sample for multiple reasons, right? But it gives you some time to shop around and make sure that you're purchasing that medication at the correct pharmacy. And when I say correct pharmacy, every pharmacy has a different cost for these medications, and this is especially true on the high deductible health plan. So here locally where I'm at, I may go to my local Costco versus going to my HEB for the exact same medication, but the prices are going to be different. Number 4, we always encourage you to use urgent care or virtual visits or even after-hour clinics for any type of urgent situation that's not a life or limb-threatening event. Of course, if it's a life or limb-threatening event, go to the nearest emergency room. But we still are finding that emergency rooms are being misused for just convenience matters. And there are a lot of other areas that we can go seek care for if it's not, under the normal 8 to 5 hours. Excuse me. Austin Regional Clinic is a great clinic in our area, and they provide Saturday, Sunday clinics. So there's other places that we can go for care if it's not life or limb threatening. And then just as a reminder, preventive care is covered at 100%. Always want to encourage you to go out and keep up on those annual physicals, well woman exams, mammograms, colonoscopies, whatever applies for your age range. But again, it's covered at 100% regardless of which plan you select. Virtual visits, again, this is a great benefit that you have, and new for this year under the high deductible health plan, there's no copay. There's no charge that you have to pay. It's picked up at 100% when we go with United Healthcare. So just make sure you're using a designated provider for virtual visits, which you'll find on the UHC app. And this is nothing new to us. I know we're all kind of used to virtual visits and telemedicine, but just as a reminder, there's some common conditions that they can treat over the phone, and they can also prescribe a medication if you need a medication. We've got a couple of claims examples. This first example is going to be what I call an infrequent user. So, they have their annual preventative care. They go out for a primary care office visit, monthly maintenance prescription. That means they take it every day, 365 days out of the year, have an urgent care visit and a specialist visit. If I'm on the high deductible health plan, I have to pay 100% out of my pocket until I reach that $3,000 deductible. So if we add those various charges out, it comes out to $865. If I'm on the base or the buy-up plan, again, I have to pay the appropriate copay that's attached to these visits, and that looks like about $245. You also need to take into account how much are you paying for these plans out of your pocket from a premium paycheck perspective, right? So depending on what plan I am, I have a certain amount coming out of my paycheck each pay period. So we've taken that into account and we've added that up together as an annual premium cost. How much did it cost us over the entire 12 months, December 1 to November 30th next year? And then we also take into consideration that we have some free HSA dollars there on the high deductible health plan. So we can deduct that from that $865. So if we had, a magic crystal ball and we knew what was going to happen over the next 12 months, we can see here that from a cost perspective, that high deductible health plan would be the least expensive out of our pocket, taking everything into consideration. Not to scare anyone, but I always like to think about worst case scenario when I'm comparing medical plans. If something happens to me or my dependents, what's the worst case dollar amounts coming out of my pocket? So under this example, we've done employee only, and we're going to say that we've had a hospitalization and maybe some outpatient services afterwards, and we've reached our out-of-pocket maximum during the calendar year. So on that high deductible health plan, that's $3,000. Under the base PPO, it's $5,000. Under the buy-up PPO plan, it's $3,500. We still have to take that annual premium cost into consideration. So that's the dollars that are coming out of our paycheck on a per pay period basis, added up throughout the year. So again, not knowing what the future holds in the next 12 months, looking at this worst case scenario, the high deductible health plan comes in at $3,633. The base PPO plan is $6,620, and the buy-up PPO plan is $6,638. These are your rates going into December 1st, 2023. You'll see that the employees in that high deductible health plan, you actually have a couple of discounts there. Those rates are slightly lower than what you were paying under Blue Cross and Blue Shield. With the other plans, we're talking very minimal increases, maybe a buck or two here or there. But this is really great news for you as employees. We all know about inflation and how things are going today in the world. And it's exciting to know that you work for a great employer that's still paying a majority of the healthcare cost for you. And they're able to keep your cost low through moving to United Healthcare. Tax savings accounts. We just always like to remind employees that there are ways that we can save through our taxes by using either a health savings account or a flexible spending account. And that's putting aside tax-free contributions to use for things we're already paying for, medical, dental, and vision expenses. In this example, we've given you two columns, said your taxable income was $50,000. Your pre-tax contribution into that tax savings account of $2,000 reduces how much they're taking out in federal and Social Security. So you have additional spendable income in this example of about $654. Health savings account again is staying with WEX. We're not making any changes to that. With your health savings account, that is your own personal bank account to use for your medical, dental, and vision expenses. You must be enrolled in the high deductible health plan in order to open up a health savings account. One of the great parts about the health savings account is that it goes with you. If you leave Volusion, then that account goes with you. If you change plans next year over to the base or the buy-up, you still have the money in that account to use. So it's really one of the few accounts that we have that we call triple tax advantage. The money you put in there is tax-free. As that balance grows, it grows tax-free within your HSA. And when you withdraw the money from your HSA, as long as you use it for eligible expenses, it is tax-free as well. There are certain qualifications for the HSA. We've included that in the benefit guide, but just as a reminder, you must be enrolled in the high deductible health plan. You cannot be covered under what we call a non-qualified health plan, and this includes Medicare and your spouse's coverage. You can't be claimed as a dependent on someone else's tax return, and you cannot participate in what we call a traditional flexible spending account, and this includes your spouse. Every year, the federal government changes the annual maximum amount. So because we have a December 1st off calendar year plan, we like to put both the 2023 maximum listed as well as the 2024 for that new plan year that we're going into. So if I am looking at this for 2024, and I'm employee only, I can put up to $3,850 into my HSA. Flexible spending accounts. If I am enrolled in the base or the buy-up PPO plan, this is the account that allows me to save tax dollars. Again, I can put aside money tax-free for eligible medical, dental, and vision expenses for myself and my tax dependents. You can contribute up to $3,000 and $3,050 for the December 1st plan year. One thing to note is that this is a use it or lose it account versus the account we just talked about with the HSA. If I put $3,000 into this account and come the end of the plan year next year, November 30th, 2024, I haven't used that $3,000. Maybe I didn't have the expenses I thought I was. I'm going to lose that money. There's unfortunately rules around it, and we can't just pay it back directly to you. It's something that has to be forfeited. So we always encourage you to be very conservative about the money that you put into your healthcare FSA. You don't want to put money in there thinking, I might have this. I might go and get those crowns that I need on my teeth. You want to be 100% confident that these are the services you're going to have for sure. There is a rollover feature that is great. You can roll over up to $610 into the following plan year. You also have the option of electing a dependent care flexible spending account. Please note with the dependent care FSA, you can also have a health savings account. The dependent care FSA does not make you ineligible for the HSA. That dependent care FSA is used for care of your children while you and your spouse are at work. Things such as daycare, after school care, summer care, as long as it's not an overnight camp. You can put up to $5,000 tax-free into your dependent care FSA. Dental, again, we're moving the dental plan over to United Healthcare. There have been some differences on the dental plan as well. Again, we tried to match up these plans as closely as possible, but there are some tweaks onto the plan that we unfortunately didn't have a lot of control over. So on this low plan, we've kept your deductible $25 per individual, $75 per family. Your calendar year maximum is $1,250. That means that United Healthcare will pay out $1,250 per person that's covered on the plan from January 1 to December 31st. Preventative care is covered at 100% under the low plan, basic care at 80%, major care is covered at 50%. Orthodontia does not apply on the low plan. Your out-of-network reimbursement on the low plan is what we call maximum allowable charge. So this reimbursement level is not as high as what we have on the high plan if you're going out of network. So if you know that you're going out of network, I would encourage you to select the high plan because it is going to pay that out-of-network dentist at a higher reimbursement level. On the high plan, again, we've got a couple of differences. Our deductible has changed to $50 per individual, $150 per family. We have that calendar year maximum of $2,000. And then again, coverage for preventative, basic, and major. And then we do cover orthodontia care on the high plan. So if you need those braces. Your out-of-network reimbursement is at the higher level at the high plan. It's at 90th percentile of usual and customary. Always want to encourage you to find an in-network dentist. When you call your dental office, don't ask them if they are accepting United Healthcare. Ask them if they are participating in the in-network with UHC. All dentist offices are going to tell you they will accept any insurance, but that doesn't mean that they are an in-network dentist. So just want to be cautious about that. Again, we encourage you to stay in network because you see the difference just right here on an annual preventative care charge. If you go out of network, you will be balance billed because an out of network dentist does not accept what that in-network fee is that United Healthcare pays their providers. Again, here are the per pay period rates for the low and the high plan. If you have a UHC dentist, that's great. The low plan's a great option for you. If you're 100% sure that you're going to be going out of network to the dentist, I do encourage you to be on the high plan. You're going to get more reimbursement to that out of network dentist by being on the high plan. Vision. And let me back up for dental for one moment. A couple of things. Your current dental benefits end November 30th. If you have services being rendered, great, get those done. But we're in a unique situation because it's a calendar year maximum. So you have a brand new calendar year maximum on December 1, 2023 that goes to December 31st, 2023. And then on January 1st, 2024, you get another brand new calendar year maximum. So if you've had some dental work that you've been putting off, or you have some upcoming, I would work with your dentist on that, see what you can get done in the month of December, take advantage of that new calendar year maximum, and then January 1st, you have another new calendar year maximum. We're not always in this kind of situation, moving plans and being able to do this. So I encourage you to take advantage of it. Vision. Vision's moving to United Healthcare effective December 1st. The benefits are done differently on the frequency, but if you haven't used your current benefits with the Guardian, go out and get those new glasses, go out and get the contact lens, whatever it is that you want between now and November 30th, because then you get a brand new benefit starting December 1st. So we're in a situation that you could really have, two benefits back to back with these carriers if you haven't used them with the Guardian. Your eye exam's $10, prescription deck glasses is $25. They have a $130 frame allowance, and your contact lens is a $125 allowance. Your frequency is what we call 12-12-24, meaning you can have your eye exam and your lenses once every 12 months, and your frames are once every 24 months. These are based on dates of services. That's why I encourage you to, go early in December to get that eye exam, and then that 12-month is counting, and you can go the following December of 2024 and get your eye exam or your lenses again. These are your per pay period rates under the vision plan. Voluntary life. If you currently have voluntary life, oh, and we left the guardian on there. Look at that. If you currently have voluntary life under the guardian, we will grandfather you. And the term grandfather means that, maybe I have $250,000 today under guardian. United Healthcare is going to accept that amount with no questions asked. This is a one-time special open enrollment. We don't get this very often. So if for some reason you didn't elect it under Guardian, but you want to elect it December 1st with United Healthcare, I encourage you to do that because it's your opportunity to have up to the guarantee issue amount with no questions asked. That means that I can have that guarantee issue election and I don't have to submit an evidence of insurability form. But again, if I currently have voluntary life and I just want to keep that the same, not a problem. It's just going to roll over and stay the same as long as I make that election going through open enrollment. Disability. We are going to have voluntary short-term disability with United Healthcare. Under that, it's very similar to what we have today with Guardian. It is a 14-day elimination period. After we've reached that 14-day elimination period, we start receiving a short-term disability benefit. We are all going to have what we call employer-paid long-term disability. So all employees will have long-term disability after 180 days of being out. We would start receiving a benefit under the long-term disability plan. Employee Assistance Program, effective December 1st, that Employee Assistance Program is moving to United Healthcare. We have up to 3 face-to-face visits per year per issue. We have a great 800 number, as well as we can have online resources. Any EAP can help us with so many different things. Maybe we have a stressful relationship at home. Maybe it's a rowdy teenager. Maybe we have some financial concerns. The list really goes on. Maybe, unfortunately, we've had the loss of a loved one. The EAP is there to help us. They provide us confidential help. There's no report or list that goes back that says that an employee has utilized them. So it's a great resource to have. You also will have the option to purchase critical illness insurance, similar to what we had with United Healthcare. I'm sorry, similar to what we had with Guardian under the United Healthcare. The coverages levels are a little different here. With the critical illness, it's a flat $10,000 for employee, $5,000 for spouse, or $2,500 for children. Very similar to lists of what the covered conditions are. Things like cancer, heart attack, stroke. These would be items that would be covered and United Healthcare would provide you with a check back. It is important to note that you have to have these conditions as of December 1st going forward. Something that you're being treated for today, they're not going to provide a benefit to you. The accident plan, again, another cash benefit. This does not replace your health insurance by any means, but if you have an accident and depending what the treatment plan is, they're going to give you a cash benefit back. For example, if I am in an accident and I am admitted into the hospital, they're going to write me a check back for $1,000. No questions asked. Rebecca was playing basketball with her kids. She fell, she broke her leg, whatever the case is. As long as I have the receipt and they can see that it was accident, they will give me a check back, depending on the various things, right? Urgent care at $75, concussions $100. These are stackable. So if I go into urgent care, $75. If I was because of a concussion, that's another $100. So $175 just for that visit. With the accident, I can do anything I want with that cash. I can use it to help offset my deductible. On both the critical illness and the accident plan, the premium does increase as you age. So it's a 5-year age bracket. Every new age bracket, that premium will increase. There is a wellness benefit of $50 per calendar year. There is pre-existing condition limitations. So if you're currently not covered today, then you are going to be subject to that pre-X. They're going to look back 12 months on that critical illness to see if you've been treated for any condition. And if you have, that condition would not be covered for the first 12 months of the policy. You have access to the Benefit Advocate Center. It's a great resource to you. You can use them as an employee of Volusion for a variety of different things. We've listed some of the examples on the screen. You also have access to myself and Rob. We're going to be doing some one-on-one and open enrollment meetings with you on next week on Halloween on October 31st. I know there's still some availability there for us to do that.